Startuprad.io, your podcast and YouTube blog covering the German startup scene with news, interviews, and live events.
Hello and welcome back, everybody. This is Joe from Startuprad.io, your startup podcast and YouTube blog from Germany, Austria, and Switzerland, also known as the authority on GSA, German, Swiss, and Austrian startups. Our journey at the Business Angel Day 2024 in the lovely city of Mainz continues. In this episode, we'll explore innovative ideas and transformative discussions that emerged during this event. From key investment trends to breakthrough technologies, get ready to hear firsthand from industry leaders and rising stars in the startup scene. Don't miss out on this inspiring and innovative episode. And please keep in mind that is also a live recorded version on site. So the interviews were taken on site. There may be a little bit background noise, but we did our best to really delete this. Happy to get your feedback. Go down here in the show notes and leave us feedback in the feedback form. Thank you and have a good day. Hello and welcome to another interview from the Business Angel Summit 2024. I would like to welcome
Thomas Roth from Incipio.
What specific challenges in surgical planning does Incipio address, and who are your primary target customers?
There are more than 6 million surgeries every year that require pre-operative surgical planning. Surgical planning is necessary when it comes to designing transplants or implants patient-specifically, such as facial reconstructions after tumor removal. That's actually where we are starting. We will then scale from head and neck surgery into orthopedics because there's many interesting cases there. These kinds of surgeries take place in hospitals, university hospitals, rather big hospitals, where they have the capabilities of treating the patients like that. And the decision makers are usually the surgeons in the hospitals for the better patient treatment.
You have one example, a skull, on your booth. Could you elaborate a little bit more on the specific example, what is happening there and how your tool helps?
Imagine you have a patient that has a bone tumor in the lower jaw or midface. These kind of bone tumors have to be removed. And the resulting gap in the jaw has to be closed, of course, so that the patient can chew and speak again properly. And therefore, a transplant from the own patient's body is used. For example, parts of the pelvic crest, the fibular bone, or the scapula. And these bones have to be not removed, but parts of them will be taken and installed in the facial area to close the defect. That's the medical gold standard, and we're not changing that. We are changing the planning and designing of these transplants. Today, this is a very cumbersome and manual process. Surgeons have no tools or time to take care of that. So today, this is a very outsourced process. They have to outsource the planning to engineers out of the clinics, which costs a lot of time, takes a lot of their time, costs a lot of money, and leads to delays of several hours in worst cases, in extreme cases.
And basically, somebody external is planning for the surgeon, and then the surgeon starts the surgery, and then at one point they realize, oh, there was a mistake in planning. Does this happen?
It might be possible. Usually they detect misplanning or imperfections before that, because the surgeons usually check the results of the external engineers before they continue. However, it still is a pain in the ass for them, because if there's anything incorrectly planned, they have to set up another video call to discuss the changes and tell them what to do differently. So again, they have to have the second or third web meeting, which again takes their time. These engineers only work from 9 to 5, and during that time the surgeon is in the operating room, so they don't really have time for that. With our automated solution, they can do it whenever they want and wherever they want, within seconds.
Could you elaborate on the current development stage of Incipio and any significant milestones achieved to date?
Yes, of course. Incipio is a spin-off of the University Hospital RWTH Aachen. That's where the idea was born. We have started with an idea and a patent application, and what we have achieved so far is our patent is granted in the EU and the US for our novel technology. We have a very strong prototype that is almost completed and ready for use. And we are working on the certification of our software as a medical device. Our company is already ISO certified, and we already have a very strong and interdisciplinary team set up.
We may add Germany is pretty strong in engineering, but your school is one of the premier institutions for engineering.
That's right.
What are your current funding status, and are you seeking additional investments or partnerships to extend your solution?
Incipio is currently raising €2 million, and we already have commitments of roughly 1 million. We are about to close the financing round in the next couple of weeks, and with that we will get the market certification, entering the market and growing our team. We are always looking for partnerships. We are well connected in the medical world because of our spin-off situation. We are well connected in Germany, Austria, Switzerland especially, but also further abroad. We're interested in speaking to additional renowned surgeons in top hospitals around the world that are interested in medical innovation. We are also interested in partnerships with medical device manufacturers and collaboration partners, but mainly looking to close our fundraising at this point.
What strategies are you employing to integrate into existing surgical workflows, and how are you approaching customer acquisition?
We have chosen a very lean setup of our technology. Surgeons can use our technology in the web browser, so it doesn't have to be integrated in the IT systems of the hospital, nor does it have to be installed on every computer in the hospital. Only a few decision makers and planners in the clinic will use our technology, and we have the direct connection to them. So it's a very smart and easy approach to get installed or get into the hospitals.
What approach do you use for customer acquisition?
One of the biggest advantages of Incipio is that we are the spin-off of the university hospital, and our co-founder, Professor Adi Modaba, is a key opinion leader and head and neck surgeon. So that brings a lot of credibility, and we don't have to do cold calls mainly. We always get the doors opened through Adi, through our network, and that helps a lot when reaching out to users in the clinics.
What KPIs are you monitoring to assess the effectiveness of Incipio, and what outcomes have you observed so far?
Of course, we have some KPIs established in our company. For example, we are following an agile development approach in our IT and tech team. So we're doing sprint planning and detailed sprint reviews after 2 weeks, seeing whether our time scheduling and forecasts worked out. And we are getting better and better in accuracy and precision. And of course, we have some financial KPIs and controlling KPIs that we are following.
Great. Thank you very much. It was a pleasure talking to you.
Thank you. It was my pleasure to talk to you.
Hello and welcome to another interview from the Business Angel Summit 2024. Hi, can you introduce yourself?
Hi, my name is Julia and I'm from Carbon Instead.
What problem does your startup solve, and who is your target customer?
Our startup really solves the question. Today, the concrete industry is quite CO2 intensive in their production. So if you produce cement today globally, that's about 8% of the global CO2 emissions. One of the main problems in terms of climate change. And we work with a negative emission technology where we treat this negative emission technology so that it can actually be included into, for example, concrete.
Instead of bodies, you're cementing carbon dioxide.
We are working with biochar, and biochar is one of the recognized negative emission technologies by the IPCC. And we developed a patented process where you can actually treat the biochar so that it gains, for example, in reactivity and is better usable really for the guys in the construction industry.
And it basically absorbs more carbon dioxide than it produces?
No, actually, the storing process happens really at the beginning. So the process in general, you have CO2 in the air. Plants take up the CO2. For example, the trees, they grow. They build themselves basically out of carbon and release the oxygen back in the air. And once, for example, a biomass is not used anymore. For example, if a tree is like the leaves are cut, they fall down. Usually they degrade, or today they get incinerated often. And we work with a process called pyrolysis. Takes this waste biomass basically, and basically fixates the carbon in a solid form. And this is a negative emission material. And what we do, there are a lot of really cool people doing this, a lot of good plants, plant technologies, and we are really treating this carbon so that it can be used in the construction way in a way that it actually has a functional benefit.
What is your current stage of development, and what milestones have you achieved so far?
So far, we have patented our process. We have found partners in the industry to really scale the process. So the first patent process that we have, and now we're on the verge of scaling the second and third.
Mm-hmm. In terms of, you're at the Business Angel Summit, in terms of funding, what would you say is your current stage?
So far, we are funded with turnover and grants, and we have just got the first business angel round set up. Now we're really looking for partners or business angels that want to come to us, but have some additional know-how. So we're really looking for business angels from the industry, like construction industry, cement industry, anything in that direction would be really cool.
Somebody with knowledge in chemistry would also be welcome.
We do have a couple chemists on board already, but if you are from that area, you're always welcome to have a chat. Yes,
in terms of VC terminology, are we talking about seed or pre-seed?
I'd say we probably kind of in the middle, like with the first product, we are already in the market, and with the second, we're still a bit in the scaling process and the prototyping.
Mm-hmm. What is your go-to-market strategy, and how you're acquiring customers or users?
Mm-hmm. We really have a licensing model, so that we are not going to be the people really producing the materials. There are a lot of great people that can do this already. We're really enabling the people along the supply chain to do this. Yes, we're really lucky. We have a couple of very good industry partners, and of course they themselves are quite well connected. And we have some people in team which are really good connected in the construction industry as well. So.
Mm-hmm. What key metrics or KPIs are you tracking, and what results have you observed so far? So what does your startup help to do better?
Yeah, for us, really the key is functionality. So for us, to have a solution which is really good is really that we can outperform conventional material.
Mm-hmm. Do you have like any metrics that you can quote here?
For example, we're always looking at reactivity. We're always looking at, of course, the standard things like compressive strength, flexural strength, but also metrics which are a bit more delicate, like, for example, durability, and of course, CO2 footprint is one of the main things as well.
Can you give us a rough idea? You're better like 2 times, 5 times, 50 times?
We're still working on this, but it looks like we will probably be a bit better than the one. I can tell a bit more once the patent is released next year.
Okay. So you cannot tell due to patent restrictions. Yes. Okay. Thank you very much. It was a pleasure having you.
Thank you so much.
I'm bringing you another interview from the Business Angel Summit Germany 2024. Hey, can you introduce yourself briefly?
Hi, my name is Christoph Grün. I'm CEO of Kevitchen. We are a spin-off of the Karlsruhe Institute of Technology, and we're aiming to revolutionize oxygen sensing in 3D cell cultures.
How do undetected side effects during drug development impact the pharmaceutical industry, and how does Cavigen aim to address this issue?
So if you're looking at the drug development at the moment, most of the cell cultures are done under ambient atmosphere, so far away from the human conditions, with the results of your experiments are not direct transferable to the patients. So side effects can occur, and with every side effect, the time to market is longer for the drugs. This means, for example, up to $45 million. This can lead to up to 200,000 of deaths due to side effects in Europe alone. So this is a high impact that you have good in vitro models for your drug testing.
What specific challenges in vitro testing does Cavigen address, and who are your primary customers?
So you need in drug development in vitro model that's close to the human body. Not only that you have 3D cell cultures, but you need the right oxygen concentration. For example, in the heart you have around 5% of oxygen. Current methods are done under ambient atmosphere with around 20% of oxygen. So you need to adjust the setting to the human conditions. And this can Cavigen solve with our products.
And you're already holding something in your hand. Can you show that?
Yeah, we are using, you can't see it. These are microcavities. They are around 300 micrometers in diameter. And these microcavities are out of an oxygen-sensitive polymer film. We thermoform it to these cavities, and now you can culture your cells in these tiny little microcavities and measure oxygen in the direct microenvironment of the cells. And with our technology, you can get up to 15,000 of microcavities in such a plate, which means you can do high throughput experiments and create a lot of results on a single plate.
Could you elaborate on the current development stage of Cavigen and any significant milestones achieved to date?
Over the last 4 years, we've done our proof of concept of this technology. We created first prototypes, and now in the seed round, we are looking for investment to bring the idea from the prototype phase to the market.
What is your current funding status, and are you seeking additional investments or partnerships?
At the moment, we are funded by the Helmholtz Association with a funding program, and we are in a seed financing route and looking for up to 500,000 euros for the first round. To bring this idea to market, we need investment for sales and for software development.
What strategies are you employing to integrate Cavigen's technology into existing drug development workflows, and how are you approaching customer acquisition?
We can integrate our technology directly in the drug development process because you can do your current methods like microscopy as well in our microplates. So we add additional information in the ongoing process. This means customer can easily integrate our system in the process. And in the end, with our method, you have one system from the beginning of generating spheres and organoids to the end, to the results. With our system, you can start by generating the spheres and organoids, adjust to a physiological oxygen level, do your experiments under conditions that are transferable to humans, and also do your ongoing methods like microscopy or other assays, and in the end get results that are next level because you have done it under physiological conditions.
What key performance indicators, KPIs, are you monitoring to assess the effectiveness of Cavigen's solution, and what outcomes have you observed so far?
So far we can see that you can significantly reduce your time of experiments because, as I mentioned, with one system you can do the whole process from generating the cell cultures to the results. This is one thing, reducing the time of your experiments. And you can also do high throughput experiments. As I mentioned, 15,000 spheres on one plate. Current systems mostly can do like 100 to 400.
So you're significant scaling up the process?
We're scaling up the process, reducing time, reducing money, because you are saving time and you don't need so much cells for your experiments. You have higher number of data. You can do more statistics, get better results, and with a higher impact.
Do you have a rough idea how much faster the process is with you?
It's hard to say in general, because it depends on every single process, on the application, on your organ type. But what we can say is that we can provide a solution for different applications. Because of our process, we can adjust the sizes of the microcavities to the specific need. So with this in mind, it's hard to say, okay, we can reduce it by 5 times, because every process is different. And if you're looking to spheroids or organoids, yeah, you have great difference. But with our system, we can cover the whole thing, starting with small spheroids up to bigger or larger organoids. So yeah, you have to look at a specific experiment.
Great. Thank you very much.
Welcome. Thank you for the interview.
My pleasure.
That's all, folks. Find more news, streams, events, and interviews at www.startuprad.io. Remember, sharing is caring.